When I arrived in March 2011 as a clinical psychologist, I was very much attuned to the real need for training programs to increase awareness around mental illness, and I was actually surprised that there wasn't a lot that was offered.
It turns out that NAMI, so the National Alliance on Mental Illness, the nation's largest grassroots organization, has a program specifically for providers, for people who take care of folks with mental illnesses.
So we still today are the only health sciences university medical school that's offering this NAMI provider training program.
The provider program is really geared to telling people who take care of people with mental illness every day in our offices, healthcare providers, nurses, office staff. And lots of times we're confronted with issues we don't know what to do with.
We have an adult son with a serious mental illness, came to NAMI about 5 years ago and eventually became trained in several of their programs.
I went to an urgent care clinic and that doctor just had no clue. I guess his first reaction was I was possibly on the edge of a panic attack.
When someone is bringing a family member to get medical treatment for a mental illness, it's a pretty traumatizing experience for the person experiencing the mental illness and for the family.
The very first physician I went to had no compassion, almost, for my situation. And it was almost a rudeness.
We had multiple bad experiences over the course of his illness since 2008. Multiple times where providers were cold, where they wouldn't communicate with the family whatsoever.
One of the things that's great about the NAMI Provider Program is having the opportunity to try to talk to medical students, because I think a lot of medical students and residents understand that you're going to come across psych patients.
And they each have a panel of a care provider, someone who is a survivor of mental illness, like myself, a peer, and then they will have a family member of someone with mental illness.
We're seeing at patients at their worst times, usually when we're in the hospital, and it helps me better understand where those patients are coming from.
There is something about watching them respond to hearing the actual stories of things that have happened to the person with a mental illness and the families that suddenly clicks on a light bulb for them to understand it in a completely different way.
Sometimes it seems like families may be trying to insert themselves into my treatment plan, but really they're just trying to better understand what's going on with their family member.
So even if you don't want to do psychiatry, it's still important to kind of be empathetic and be caring in your approach with patients.
What this program does is makes you more comfortable with understanding where the patient's coming from, where the family's coming from.
One of the most striking comments we got was from a young woman who's going to be a surgeon. At the end of the training, she looked at one of the people on the teaching panel in her group, and she said, "This is going to make me a better surgeon. This is going to change how I take care of my patients."
The students that graduate from Des Moines University, regardless of the specialty they choose, they get it. They understand what it means to really have an appreciation for the healthcare needs of those experiencing a mental illness.
When the healthcare staff is treating the patient, they want to treat the total patient, and that includes the patient that is living with mental illness. This is the kind of program and partnership that is critical to NAMI's success.
The NAMI Provider Program is an essential piece to helping practitioners learn about the first-person experience of living with a mental health condition. I can say as a practitioner, this program has helped me deepen my understanding of what it's like to live with a mental health condition. By having this perspective, we believe this will make you a more complete practitioner. We thank you